Student, our next topic concerning to excretory system is nothing but hemodialysis. Okay. Now, what is hemodialysis? Hemodialysis is used in case of severe kidney problem and kidney failures as well. Suppose a person is suffering from uremia, as I have discussed, the presence of urea more than that of the optimum quantity may prove harmful for the person. So, if a person is suffering from uremia, it may cause kidney failure. It is highly harmful for the patient. In such patient, what to do? The removal of urea is necessary. Okay, so the urea from the blood of such patient can be removed through a process that is called hemodialysis. For this, for the same, we use artificial kidney or dialyzing fluid, dialyzing membrane. This is the instrument for dialysis. Dialyzing membrane is also there in the nephron as well. So, like that, artificially, scientists have made the same. Okay. Now, what is dialyzing unit? Dialyzing unit, you have studied in standard 10th as well. Dialyzing unit is nothing but contain a coiled cellophane tubule or tube surrounding the dialyzing fluid. Okay, coiled cellophane tubes. Okay, surrounded by dialyzing fluid. So, what is this dialyzing fluid? Dialyzing fluid is same as that of plasma of human being. So, what is the difference? This dialyzing fluid having the same composition as that of plasma. Only difference is that means only except the presence of nitrogenous waste, as it does not have any nitrogenous waste but a plasma content. Okay, so this is about the dialyzing fluid and dialyzing membrane. So now the person is suffering from renal failure due to presence of more urea in blood. He is having the or under the procedure of dialysis. Okay, in this process the blood is drained from vein or artery. Can you tell me? Yes, artery. Artery, that is convenient artery, whether from neck side, from any artery of the any part of the body. This is under elbow, from thigh, whichever is convenient. So the blood is drained from a convenient artery, is pumped into dialyzing unit. I have described it. But before sending it to the dialyzing unit, doctor will add some anticoagulant in that blood. This anticoagulant is nothing but the heparin. Okay? So this heparin in that blood. Now the blood. Why he's adding the same? Because it should not be coagulate or clot over there. Okay? Now the dialysis is occurring. The procedure is going on. The blood is passing through the cellophane tube, which is surrounded by the dialyzing fluid, whose composition is the same as that of plasma except containing nitrogenous waste. Therefore, because there is no any nitrogenous waste in the surrounding dialyzing fluid, but a lot of nitrogenous waste in the blood, which is passing through these cellophane, and cellophane tubes are porous. So, where is the concentration of the nitrogenous wastage higher, in a blood or in the surrounding fluid? Surrounding fluid have no any nitrogenous waste. So, to the down the gradient from the blood to the dialyzing fluid, the nitrogenous waste will pass from the blood to that fluid. Are you getting me?
Yes, sir.
Okay. So now it is very clear that the porous cellophane tube membrane of these tubes, porous membrane of these tubes allows the passage of the molecule based on the concentration gradient. As nitrogenous waste are absent in this fluid, so what happened then? This fluid and these gradients, these substances from the blood move freely out of the blood. Is that clear? Thereby
Yes, sir.
cleaning the blood. So now the blood is getting pure. Now the blood is pure without any nitrogenous waste. Now this blood is again pumped into that patient. So now this will be pumped through the vein or artery. Vein. The blood was drained through the artery and the blood should be pumped back through the vein. But before pumping the blood back, we have to add some anticoagulant or antiheparin to it. As initially we have added the heparin to prevent the coagulation outside of the body. And when we are pumping back the blood after purification, we have to add the antiheparin or the antiheparin so that it will neutralize the effect of the heparin which we already added. So this is all about the hemodialysis. Is there any question or clear?